my dear viewers. I hope everyone is doing good. And today I came up with one another interesting topic that will be much helpful and useful for your studies. Today in this topic, we'll be talking about some of the common neonatal disorders, right? Generally, a wide range of disorders which are affecting the newborn may be started in the utero as well or during the birth, as well as it can be immediately postnatal period. That means after the birth of the child. These disorders may be due to the prematurity, genetic mutations. There can be the possibility of chromosomal aberrations as well as the disorders which are occurred from the environment. Yes, today we are going to talk about the birth injuries. That is the part of this common neonatal disorder. This part will be discussed today. These birth injuries, they occur during the birth process. They usually occur if the baby's size is large, if the breech presentation is present, or it can be with the forceful extraction of the baby. These birth disorders, it can be classified according to the structure that is injured. That means the part which is injured during any of the, any of the causes, it will be classified according to that. It may include the soft tissue injury, head injury, nerve injury. First, we'll be talking about the soft tissue injury. These soft tissue injuries may include the erythema and the abrasion. This very particular injury may occur when there is an application of the forceps during the delivery, and it may directly cause the abrasions or the erythema to the baby's body. Next injury under this may come the patagy. These patagies are the non-raised, will be the pinpoint hemorrhages which is caused by the sudden increase and then a release of the pressure during the passage through the birth canal. That is when the child is being pulled out or when the child is passing through the canal of the vagina of the mother. So by the time it can be, if the pressure is applied, then release. So this may cause this hemorrhagic pinpoints. These patagies you can find out over the chest or the face as well as the head of the baby. Next comes the ecchymosis. After any traumatic delivery, if it is like not normal, if it is like a traumatic way, so it may cause small hemorrhagic areas or hemorrhagic patches over the body of a child. Next, the soft tissue injury may include the subconjunctival hemorrhage. That means the rupture of the capillaries which is present, that means which are present in the sclera, or it can occur from the pressure on the fetal head when during the delivery, if the pressure is applied on the child's head or the baby's head, and this may damage the small capillaries which are present in the sclera of the eye. The next thing we are talking about, the head injury. It may include the caput succinum. This caput succinum is basically a swelling or edema of an infant's scalp that appears as a lump or the bump. It is very seen over the scalp of the child on their head shortly after the delivery. It will be seen. It often appears at the vertex of the child's or the newborn's head as a result of the pressure which is done against the mother's cervix during the birth canal. That means during the labor, when the child is passing through the canal, if there is pressure against that cervix wall, then it may lead to the presence of this caput succinum. So usually this swelling contains the serum or the presence of the blood which is usually accumulated by the tissues or in the tissues above the bone. What causes this condition of the newborn? If the delivery is prolonged or the delivery is difficult that means the baby is not able to come or pass on through the canal very easily. When there is prolonged or the difficulty delivery, usually the vacuum extraction is to be done during the difficult birth. That can also have an impact over these chances of having caput succinum. If there is a presence of the premature rupture of the membranes, that means the fluid in the amniotic sac, which is protecting the baby against the infections or which is providing a cushion to the baby's head. And if there is loss of that membranes, the baby's head is usually exposed out. How to find out how to diagnose this condition? It can be diagnosed by the prenatal ultrasonography. That means it can be the last level, the last term of the ultrasonography, or even before labor or before delivery. Treatment for this condition. Usually, there's no specific treatment needed for this condition, and the swelling may subside within a few days after the delivery. Next condition under this injury is the subgaleal hemorrhage. It is the collection of the blood beneath the layer that's called the aponeurosis, that is covering the inner surface of the scalp. Causes for this condition is this injury occurs generally by the result of forceps delivery that pushes as well as drags the child's head or drags the child's body throughout the pelvic outlet. This condition usually manifests as a firm flatulent mass which is present over the head of the baby that increases in size when the baby is born. Monitoring the infant for changes in the level of consciousness as well as the decrease in the hematocrit level are the keys which may help in recognition as well as in management of this condition. The next condition under this injury is the cephalohematoma. So this is a condition where there is a collection of the blood between the periosteum of the bone as well as the bone itself. It may occur either on the one side or the both sides of the head. So this swelling of the hematoma will not be present when the child is born, but it may appear after 24 to 48 hours of the birth. What can cause this cephalohematoma condition? During the time of the birth, if there is pressure applied over the head of the baby, so there can be the rupture of the periosteal capillaries, which may lead to the pooling of the blood in between the bone and the periosteum. In case of the instrument delivery, again this may lead to the rupture of the capillaries. The treatment or management. No treatment is done unless it is uncomplicated or there is no serious condition seen by the time of the birth. But if there is presence of any complications, immediate treatment is to be done. Most lesions of this hematoma will be absorbed by the 2 weeks of the age, or it may lead to 3 months and it will be disappeared. The next condition comes the subdural hemorrhage. This condition is life-threatening as there is a collection of blood in the subdural space. Subdural hemorrhage or the hematoma, it's a type of bleeding that often occurs outside the brain and which is pulled out outside the brain as a result of severe head injury during the fall of the child or the excess pressure over the head of the child. It takes place when the blood vessels, blood capillaries are bursted, between the brain as well as the covering, which is the leather-like membrane which is covering the brain, that is called the dura mater. Between these membranes, between the brain and the layer of the brain that is covering, so in between when there is a presence of the blood, so it may lead to the complications. Another condition we'll be talking about is the subarachnoid hemorrhage. This one is the most common type of the intracranial hemorrhage, which may occur below the arachnoid membrane. Majority of the infants will not be showing any of the clinical features, but it can be detected when there is an elevated number of the red blood cells found, that means which are found in the lumbar puncture sample. Another condition we'll be talking about is the intracranial hemorrhage. It usually develops spontaneously, and it often involves the ventricles of the premature infants that are delivered without any trauma. This condition is considered as the serious emergency, as the buildup of the blood in the skull can result in increase in the intracranial pressure, which can result into the crushing of the delicate brain tissue, or it may limit the blood supply to the brain. How this intracranial bleeding is caused? It's caused when a blood vessel within the skull is ruptured or when it leaks. It can result from any of the physical trauma, such as the head injury, or even in the non-traumatic causes, for example, in the hemorrhagic shock. Majority of the infants will not be having any of the clinical manifestations. Premature infants who are having the severe hemorrhage may have presence of some of the symptoms like the decreased muscle tone. There may be presence of the apnea, pallor, or the cyanosis present over the bodies, present in the body of the infants, as well as there will be the presence of poor sucking, high pitched cry in the child, as well as convulsions are seen in the infants. As soon as these kind of symptoms are found, these symptoms are identified, then immediate treatment is to be started. Improved perinatal care is imperative to minimize the traumatic birth of the child, or to subside the brain injury and decrease the chances of preterm delivery. The next injury we are talking about is the nerve injury. And then the very first nerve injury comes in your mind is facial palsy. When there is a pressure over the facial nerve during the delivery, what happens is it may result in the injury to the cranial nerve. So this results in the loss of movement on affected side of the face and the forehead where the cranial nerve actually is damaged. This is usually manifested when the infant cries. A movement from the unaffected side is usually seen, and on over the affected side, the eyes will not. That means the eye will not close, and the corner of the mouth will be dropped. In this case, no, medical treatment or management is to be done, as this will improve within some of the days after birth. The eye which is exposed, that means which is affected, the care for that eye, as there is no regular movement for that, so the care is essential. In case the paralysis of the side is persistent, when there is no improvement or the change after some of the days, then a neuroplasty is the option to get rid of. Next comes the brachial palsy. So injury to the brachial plexus, it causes the paralysis of the upper part of the arm. It can be with or without the involvement of the forearm as well as the hand. Some of the clinical types of this nerve injury can be abduction paralysis, or you can call it as the Erb's palsy. Then the Klumpke's palsy. Let's see this Erb's palsy. When there is a damage to the upper part, that means the upper portion of the plexus, and usually results from a stretching or pulling out of the shoulder of the child while delivery. The Klumpke's palsy. So this very type is it is less commonly seen, where the lower portion of the plexus palsy, it results from the severe pulling or the severe stretching of the upper extremity of the infant. What can be some of the clinical manifestations? There will be presence of the paralysis of the extremity which is affected. The affected arm will be hang limp alongside the body. The shoulder of the affected arm, it will be adducted, as well as there will be the internal rotation of the shoulder. The treatment we will talk about now. The treatment of an affected arm is aimed at preventing the contractures of the paralyzed muscle. To maintain the correct position of the arm, hand, and the shoulder if they are involved. It may take at least 3 to 6 months to recover completely or fully from the stretched nerves or this paralysis. The next palsy we will talk about is the phrenic nerve palsy. This phrenic nerve palsy, it causes the paralysis of the diaphragm, and that can be seen with the help of ultrasonography. That means there will be the presence of the elevated diaphragm, as there is a abnormality in the elevation of the diaphragm. So the presence of the distress, that is the respiratory distress, is most common sign which helps to detect this condition. Injury to this nerve, that means the phrenic nerve, is usually unilateral. So the lung on affected side does not expand well, and the breathing difficulty may occur. The baby is positioned on the affected part of the side, that means affected part of the lung, and it will help to facilitate the breathing by the unaffected part. Let me wrap up the condition which we discussed today. As I mentioned, a variety of the disorders which may affect the newborn during it can be in the utero itself, during the process of the birth, that is the labor, and after delivery as well. So we have seen some of the conditions where the newborn will be affected. It can be the injury to the head, it can be the injury to any of the soft tissues, or the nerve damage which is due to the pressure, due to any of the head injuries, or it can be due to the presence of the stretching or pulling away the part of the body. So depending on the part which is affected with the with the delivery or during the time of the pregnancy, so these may all lead to some of the conditions. But if these things are uncomplicated, if these conditions are uncomplicated, they don't need any of the treatment, then they will be resumed, they will be restored after some of the days. So there is no particular treatment done unless it is complicated. This is me, Arvina Jan, signing off for this time. I'll see you in the next session where I'll be dealing with another part of it. Till then, take care and thank you.